In my role as a clinical director for medicine at Sale University Healthcare Group, I'm very conscious of the impact that respiratory virus infections are having on the health service over the last few months. Very large numbers of patients are presenting to the emergency departments quite sick from their viral illnesses, and this is putting a lot of pressure on both the patients themselves and on healthcare providers. And I'd like to ask Dr. Fleming to further elucidate on maybe how we can relieve some of those pressures.
So we know that healthcare workers are more at risk of getting both COVID and influenza infections. While our infections may be mild, we are at risk during this time of transmitting infections to vulnerable patients. Worldwide, it is therefore recommended that healthcare workers get both annual influenza vaccines and COVID vaccines and boosters. And therefore, as an infectious disease physician who sees the consequence of these infections in vulnerable patients, I would ask that anybody working in the hospital receive their annual flu vaccine and their COVID vaccines, including boosters. And I think our patients will thank you.
And I would also like to reiterate that this advice also holds for the general public. We'd like to see the general public update their vaccination status in relation to both flu and COVID.